Hello there. My name is Fabrizio Galimberti. I'm a dermatologist. I practice in South Carolina. And today I'm quite excited to talk to you about the molecular biology of GPP or generalized pustular psoriasis. Um, we know that these patients are out there. Sometimes we see them in clinic. Sometimes we get referral from the emergency room or urgent care because they have a scary rash with systemic symptoms, fatigue, fevers. But until a few years ago, we treat them pretty much the same as our plaque psoriasis patients. However, GPP, generalized pustular psoriasis, it's quite distinct. It's quite different from your plaque psoriasis. Not just because your patients look different, not just because there is more morbidity and even mortality with GPP flare, but because at the end of the day, it is really a different subtype of psoriasis, perhaps even a very different type of disease that has a completely different molecular biology. A few years ago, we might have used acitretin, cyclosporine, or IL-17, IL-23s, and TNFs for the treatment of GPP. But molecular biology has shown, as well as genetic studies, that those cytokine and interleukins and overall the immune system, of course, they play a role, but GPP is different. There is one and only one specific driver of this disease, and that's the IL-36 pathway. Now, patients with GPP, with or without a genetic mutation in their IL-36 receptor antagonist, do have a higher level of this interleukin and cytokine that drives their inflammation. So I want to contrast two similar disease states, but they're very different, right? We have the autoimmune, think of psoriasis. Those are driven by your adaptive B or T cells, in the case of psoriasis, T cells. And then we have the autoinflammatory diseases like GPP, which are more neutrophilic. And guess what? IL-36 drives neutrophil proliferation, drives neutrophil infiltration. And we know that a biopsy of GPP, it's quite different under the microscope of that of psoriasis, significantly more neutrophil. And it all goes back to the fact that the IL-36 pathway is the one that it's overactivated. Now, whenever you use cyclosporine, acitretin, a lot of prednisone for these patients or other biologics, you will have some downstream effectors that eventually will interfere with the pathway. But only when you target IL-36, you really block the key driver of that inflammatory pathway. And through multiple clinical trials, we finally led to the development of a IL-36 blockade pathway, right? We can block the pathway. That, of course, is spesolimab. It is an incredibly targeted medication in a disease state where we have one key mediator, so not a plethora, not a lot of different inflammatory cytokines that come into play. And that is quite obvious when you look at the results of the clinical trials. Even for patients with severe flares, the majority of them will have dramatic improvement after just one dose. Think of the infusions for the flares. And in the open label extension of the FSL trials, the majority of patients were free of flares for up to 3 years, just by blocking one cytokine. Now, you get a lot of questions about these pathways, right? So does it mean that the other pathways are not important? That's not the case. IL-36 is the key molecular pathway, but of course, other pathways are important because eventually the adaptive immunity gets triggered as well. So that's why whenever you chose to use methotrexate, prednisone, cyclosporine, azathioprine, a TNF, an IL-23, or an IL-17, you did see some partial response, but you didn't get that deep, profound level of improvement and that astonishing prevention of flares. And let me remind you that the flares for GPP have mortality and morbidity associated with them. So this really emphasizes how GPP is driven by IL-36. On the other side of the coin, the question that you might have is, well, is IL-36 crucial and important for plaque psoriasis? And the answer is most likely no. Now, we know from previous clinical trials that patients with plaque psoriasis and GPP who were treated with spesolimab had an improvement, resolution, prevention of flares of the GPP, but their plaque psoriasis didn't get better. Moreover, when you do staining or you do look for expression levels of proteins, we see very high level of IL-36 in GPP, relatively normal to low levels of IL-36 in plaque psoriasis. So whenever you see a patient with GPP, whether it's in a flare or maintenance and prevention of flares, you do have the option of choosing spesolimab, the only FDA-approved treatment for GPP, because when you block the IL-36 pathway, you not only block the inflammatory driver for the GPP, but you also block the inflammatory pathway that most likely leads to all those systemic symptoms that GPP patients experience with or without a flare. Remember that the vast majority of patients with GPP, even when they don't have a flare, they live in fear of a flare, and they still experience fatigue, joint tenderness, fevers, all these what we call B symptoms that are usually associated with inflammation. So I hope that today I was able to emphasize and to communicate how plaque psoriasis and GPP are two completely different subsets. Plaque psoriasis, that's a autoimmune condition driven by IL-23, driven by IL-17, driven by your adaptive immune system, whereas when we think of GPP, generalized pustular psoriasis, that's an autoinflammatory disease driven by neutrophils, the innate immune system, and is specific by IL-36. So two different conditions. They're different in clinic, the way that we see the patients. They're different under the microscope when we look at them through a pathologist's eyes, and they are different in how we approach them clinically, because we're going to make different choices for our psoriasis patients, a lot of choices. But when it comes to GPP, we want to block the IL-36, and we only have one FDA-approved option, and that's spesolimab. So I hope that this helped in helping your patients with GPP in clinic. And remember, be on the lookout for GPP, because he has a lot of different clinical presentations, and you will find one.